Hello, and welcome to the Invite Home Lenacapavir injection training. My name is Jonathan Van Nuys. I'm a nurse practitioner and a study clinician at the UCSF Invite Home study. So, today we'll be talking about home-based injections. Why do home-based injections? Well, for some people, going into a clinic every 6 months can be a burden or a hassle, and home injections provide another opportunity, another option for how people can receive their lenacapavir injections in the comfort of their own home. And either people can choose a buddy, such as a friend, family member, partner, or spouse, to give them the injection, or they can be taught to give the injection themselves if preferred. So today we're going to talk about our goal is that if you choose a treatment buddy, they'll be able to describe the lenacapavir injection process and safely administer injections to the person prescribed lenacapavir. Or if you're doing it yourself, that you'll be able to confidently give yourself the lenacapavir injection. Today, so we're going to go over how the medication works, materials that are needed, how to prepare for the injection, injection technique, basic universal precautions, side effects, and our needle stick protocol. So let's get started with how the medication works. So lenacapavir consists of one anti-HIV medication. When it's used by itself, it can be used for PrEP to prevent HIV. For HIV treatment, it must always be paired with other medications to be a complete regimen. So it's administered as a shot, as two shots, either in the abdomen or the thighs every 6 months. And the way it works is it slowly releases the medication over time to maintain a consistent level of medicine in the body, either to prevent HIV and if you're using it for PrEP, or along with other medications for HIV treatment to reduce the viral load and help people with HIV stay healthy. Here's a nice little graphic about how it works, but it basically blocks the HIV capsid, which is a protein shell that surrounds the virus's genetic material. By blocking HIV from making copies of itself, lenacapavir prevents HIV from assembling, providing protection from HIV and PrEP, or greatly reducing the amount of HIV in the blood, which is known as the viral load in HIV treatment. So what materials do we need? Well, let's start with the medication itself. So lenacapavir comes in a box with 2 vials of lenacapavir, 2 syringes, 2 withdrawal needles, and 2 injection needles. This medication will be either sent to you or brought to you by the study team. Also, with the medication, you'll receive a sharps container for disposing of needles. Other materials that the team will bring will be gloves, alcohol wipes, gauze pads, absorbent pads that are also sometimes called chucks, and bandages. So how do you get the medication? Well, our partner pharmacy will deliver the medication to your home, or if not, then the study team will make sure that you get it. Our Invite Home study coordinator will help you with any necessary paperwork to receive the medication and will help you set that all up. Medicines are usually sent one of two ways, either by courier or FedEx. A signature will be required for them to leave the medication. If you won't be at home, but a trusted person will, you can let them know that any adult can sign for the medication. And usually that morning, the courier driver maps out their route. And at that point, they'll text or call you with an expected 2-hour delivery window, or with FedEx, they'll usually deliver between 10:30 a.m. but no later than noon. So how do you store the medication? Well, it's pretty simple. Lenacapavir should be stored at room temperature. It does not need to go in the fridge. You do want to keep it away from light, so don't leave it out in the sun or a hot car, but just a cabinet is fine, room temperature. First injection day, the Invite Home Study Coordinator will schedule a time for the study clinician to come do the training with you in person at the location of your choosing. So at that first visit, depending whether you're having a buddy help you do the injection or you're doing it yourself, which we're calling treatment buddies for the buddy and Lem buddies for people who are doing it themselves. So we'll combine the training and the practice with the study clinician on that first injection day. The study clinician will review the injection checklist with you and answer any questions. All the needed materials for safe injection will be provided by our study staff either before or on the day of training for the first injection day so that you have everything that you need. And then either your treatment buddy, if they're injecting you, or yourself, Len buddy, will practice on a mannequin, um, which which gives you the sense of injecting, and you can practice as many times as you need using the checklist. And then either your buddy or yourself will administer the medication with direct coaching from the study clinician. And then for the next visits, we'll transition to Zoom if you're all feeling ready and comfortable. So, how to prepare for the injection? It's good to do some deep breathing, so belly breaths from the stomach, just to relax. For some people, playing music is helpful to relax. You can put on any kind of music that's relaxing to you. We have some playlists as well, if that helps. People find that icing the injection before and or after the injection can help reduce injection site pain. So let's talk about the injection technique. There are two options for injection sites. The abdomen, 2 inches from the navel, is the recommended site, but alternatively, thigh injections can be used if approved by the provider. The two injection sites should be at least 4 inches from each other. And find a site that allows you to pinch enough skin to inject the medication. So areas with more body fat will give you more skin to pinch. Let's talk about some basic universal precautions. So basic universal precautions are just simple standard practices to keep people safe from germs or infections and include things like washing hands, wearing gloves, disposing of needles in a sharps container right after you use them, and disposing of any biohazard material in the trash. So what are common side effects of lenacapavir? Far and away most common side effect are injection site reactions. So you can have redness, swelling, a little bit of pain, lump, or nodules being the most common. Nodule being a hard bump that you can feel under the skin. Nausea less commonly, but people have reported nausea, headaches, stomach upset, some tiredness, joint pain, sore throat, or swollen lymph nodes. What are some strategies to reduce injection site pain? So you can ice the site before and or after the injection. You can use over-the-counter pain relievers such as acetaminophen, which is commonly known as Tylenol or ibuprofen, Advil, naproxen, something like that, if you've agreed upon that with your provider beforehand. And again, a nodule, which is like a hard bump that can be felt under the skin, will be felt by most people and may last several months. And that's nothing to worry about. It's just the medication forms what's called a depot, and the medication releases slowly from there over time. That will fade away over time. So, needle stick protocol, we're going to do everything to make sure a needle stick does not happen. But in the unlikely event, we do have a protocol that's in your folder for you to refer to. And important to know, if you get a needle stick, don't panic. Lightly wash the affected area under running water with soap. Do not scrub or suck or squeeze the wound. And then allow the wound to bleed to help flush out any potential contaminants. You can allow it to wash under running water for 15 minutes and then apply an antiseptic solution if you have one, and if available, and put a bandage. The study clinician will be there to help assess the need for post-exposure prophylaxis. This is just really for the treatment buddy if they get stuck, and advise further medical follow-up if needed. And here are some resources for you. So our invitehome.ucsf.edu website has more information and these training videos. If you're using lenacapavir for PrEP, this Yes2Go site has some videos and information on dosing. If you're using it for treatment, it's called Sulenka, and here's a link for looking at the dosing and administration of that. Well, thank you so much. And please contact us for more information or with questions. Our website is invite-home@ucsf.edu, or you can call us at 415-294-0609. Thank you.